I'm Joel Edwards, CEO with True Recovery here in Newport Beach, California. I'm here with Dr. Alejandro Alva with PNS, which is Pacific Neuropsychiatric Specialist here in Orange County. And Dr. Alva, I wanted to just kind of pick your brain real quick today and talk about what you're seeing, what you're doing to support your teams internally during this pandemic, especially on the mental health front. So kind of steps that you guys are taking to ensure that your teams feel safe when they come to the office, comfortable when they come to the office, overall create this sense of well-being so they are there fully to provide the services that they need to your patients.
Thank you, Joel. Yeah, that is incredibly important. The first thing that we do is get rid of the fear. And you get rid of the fear by providing information. We stay current with state, county, and federal guidelines, and we provide that information to our employees as they become available. By doing that, we take away the rumor mongering and we create a sense of belonging. People like to be present and they like to be involved in whatever happens in the office. We also watch out for their mental health well-being. We look specifically for anxiety, for depression, for stress, and if we notice that, we are not shy. We ask them for what is happening. Once we know what is occurring, then we can actually address it. And if that means if you feel more comfortable going home and working from home, you can. If you want to stay in the office, you can. If you are requiring a special type of divider, we provide it. Of course, the hand sanitizer, the face mask, all of those things are incredibly important. So the idea here is to get the fear out of what we do and what we live through so that our employees can be fully functional.
And Dr. Alva, I'm sure you're aware of, I think one of the things that we found to be very beneficial was in the sense of communication and collaboration was having this open environment, especially with the supervisors and executive staff of kind of this open door policy for really any employee to come in and share what's going on with him or her and really feel like they're heard, just because there's so much different things going on. And for us, the employee really taking that and then taking that step further with, as the culture we already have in place, really providing kind of support, but also encouragement. And you mentioned on other videos, like normalizing this process. So really that open line of dialogue so that no one really feels like they're on an island.
Absolutely. And I think that you and I have very similar management styles in the sense that for me, it's an open door policy. You have a question, you go to your direct supervisor. If you don't get an answer, you can come directly to the CEO. It's okay. We all work together, we're all colleagues. And again, the idea is when people feel like you care, then they feel like they belong.
I think you and I both agree that sense of belonging is extremely important for our staff as well as our clients. And so if we provide that, model that behavior, then in turn our staff's able to model to our clients and our patients, and at the end of the day, they can see what that kind of positive communication role modeling looks like.
We need to be healthy in order to create health.
Dr. Alva, thank you for your time. Greatly appreciate it. If anybody watching this video has any questions or needs some further help or direction, please feel free to reach out to us. Thank you.
Thank you.